If you have depression and anxiety, we know that you have a higher risk for developing cardiovascular disease. So up to 50% of people with depression will have up to a 50% higher risk of developing an MI or a cardiovascular event. So you can see it's a very powerful risk factor. People with cardiovascular disease have a higher prevalence of having depression and anxiety, post-traumatic stress disorder. And if you do, so I think we've said probably 1 in 3 people with cardiovascular disease will have depression or anxiety, but it varies across demographics. I think we need to address this across all sectors of the healthcare system. So when we're thinking about preventing cardiovascular disease, which often is in the community and primary care, certainly we want to find people as early as possible so that we can address their symptoms of depression and anxiety. If a person has cardiovascular disease, we're advocating the psychocardio team that is part of that collaboration that we have between primary care and cardiovascular services, the multidisciplinary team, different specialists. We should have a mental health professional as part of that team, because then they can advise us on screening, on referral, and on management. And it may be that this can be done well with the GP. The patient may have already mentioned to the GP that they are experiencing these symptoms, but it can also be done as part of our cardiovascular team. So I think we're saying it doesn't have to be in any one place, but all of us as healthcare providers need to have that increased awareness and need to think about screening people, because it's not always obvious. And patients may, they have a brief interaction with a professional, and it may not be obvious that they're also really struggling with their feelings about, what has happened to them, and maybe developing depression and an anxiety disorder.